The ketogenic diet, known for its metabolic benefits and widespread popularity in weight management, is now emerging as a potential breakthrough in mental health treatment. A growing body of research suggests that this high-fat, low-carbohydrate dietary approach could play a crucial role in improving the symptoms of severe psychiatric disorders such as schizophrenia and bipolar disorder. By influencing the body's metabolism and brain function, the ketogenic diet may offer a new pathway for enhancing both physical and mental well-being in individuals undergoing treatment with antipsychotic medications. A recent pilot study conducted by researchers at Stanford Medicine has provided compelling evidence of the psychiatric benefits associated with a ketogenic diet. Participants who adhered to this dietary approach experienced a remarkable 31% improvement on a psychiatric rating scale that measures the severity of mental illness symptoms. Notably, 3/4 of the participants reported clinically significant improvements, including better sleep quality and a greater overall sense of well-being. These findings suggest that metabolic interventions may be a valuable tool in the treatment of psychiatric conditions, particularly for patients struggling with both mental health challenges and the metabolic side effects of antipsychotic medications. For individuals living with schizophrenia or bipolar disorder, traditional treatments often involve antipsychotic drugs that help regulate brain chemistry but frequently lead to metabolic complications such as insulin resistance and obesity. These side effects can be so severe that many patients discontinue their medication, putting their mental health at further risk. However, the new research indicates that adopting a ketogenic diet not only restores metabolic health in these patients, but also leads to significant improvements in psychiatric symptoms. This discovery highlights the potential for dietary interventions to complement conventional treatments, offering a holistic approach to mental health care. The study, published in Psychiatry Research, yielded several key findings. Participants with schizophrenia experienced an average 32% improvement in their psychiatric ratings, while 69% of those with bipolar disorder showed significant progress. Perhaps even more strikingly, the study found that adherence to the ketogenic diet resulted in the reversal of metabolic syndrome among participants. Before the study, nearly 30% of the participants met the criteria for metabolic syndrome, a condition characterized by obesity, high blood sugar, elevated triglycerides, and other risk factors. After 4 months on the ketogenic diet, none of the participants had metabolic syndrome. Additionally, participants lost an average of 10% of their body weight, reduced their waist circumference by 11%, and experienced improvements in blood pressure, insulin resistance, and overall metabolic health. Dr. Shabani Sethi, an associate professor of psychiatry and behavioral sciences at Stanford and the lead author of the study, was inspired to explore the connection between diet and mental health after witnessing a remarkable case early in her career. While working in an obesity clinic, she encountered a patient with treatment-resistant schizophrenia whose auditory hallucinations significantly diminished after adopting a ketogenic diet. Intrigued, she delved into the medical literature and discovered historical reports of the ketogenic diet being used to manage schizophrenia, as well as a well-established track record of success in treating epilepsy. Recognizing the similarities between neurological and psychiatric disorders, Dr. Sethi coined the term metabolic psychiatry, a new field that examines the relationship between metabolism and mental health. One of the most compelling aspects of the ketogenic diet's potential benefits is its effect on brain metabolism. Unlike traditional approaches that focus solely on neurotransmitters, this diet targets the brain's energy systems, providing an alternative fuel source in the form of ketones. These ketones may help stabilize neural activity, reducing excessive excitability in the brain, an effect that has already been well documented in epilepsy treatment. By improving mitochondrial function and reducing neuroinflammation, the ketogenic diet could address the underlying metabolic dysfunctions believed to contribute to psychiatric conditions. During the 4-month study, 21 adults diagnosed with schizophrenia or bipolar disorder were instructed to follow a ketogenic diet consisting of approximately 10% carbohydrates, 30% protein, and 60% fat. They were not required to count calories, and they received resources such as keto-friendly cookbooks and support from health coaches. The researchers closely monitored their progress, measuring ketone levels weekly to assess adherence. At the conclusion of the trial, 14 participants fully adhered to the diet, 6 were semi-adherent, and only 1 failed to follow the dietary plan. Importantly, Those who strictly followed the diet experienced the greatest improvements, suggesting a dose-response relationship between ketogenic metabolism and psychiatric health. Beyond the numbers, participants reported feeling healthier, more energized, and more hopeful. Many noted improvements in mood stability, sleep patterns, and overall quality of life. These qualitative outcomes, combined with the measurable reductions in metabolic risk factors, point to the ketogenic diet as a promising adjunct therapy for psychiatric care. As the field of metabolic psychiatry continues to evolve, researchers are increasingly considering the role of diet in mental health treatment. While larger clinical trials are needed to confirm and refine these findings, the results of this pilot study are highly encouraging. The idea that dietary changes could significantly impact brain health challenges traditional perspectives on mental illness, opening the door to innovative, non-pharmacological treatment strategies. This growing evidence underscores the notion that improving overall metabolic health can have profound effects on brain function. Just as the ketogenic diet has been life-changing for many individuals with epilepsy, it may soon become a valuable tool in the treatment of schizophrenia, bipolar disorder, and other psychiatric conditions. By embracing a broader approach that includes dietary interventions alongside conventional therapies, the future of mental health care may become more effective, holistic, and personalized.